What's going on, guys? Medicine in 3 minutes, back here with another video, and today we're going to be talking about the carpal tunnel syndrome. Now, this is the second part of a two-part video. If you haven't checked out the first part, make sure to go check that out. Link will be in the description. It'll really help you understand the second part a lot better. So definitely go check it out before you check out part 2. So let's get straight to the point. Keep the subject clear, brief, and illustrated. So let's get started. Alright, here's a brief overview of what we'll be looking at. So we're going to be looking at the carpal tunnel and its anatomy. We're going to be looking at the carpal tunnel and how it is affected by the median nerve. We're going to be looking at some of the symptoms. We're going to be looking at how to treat it, etc. So yeah. Okay, now as I've said before in multiple videos, this channel really revolves around using pictures and images and anything to really help you refer to something you're trying to memorize. So when we're looking at the anatomy of the carpal tunnel, we're going to be looking at, of course, the carpal bones. Now, I put a couple images up for each different bone, just so you guys can remember them. And these bones are obviously from the right to left. The trapezoid, as you can see the shape, geometric shape, the trapezoid. Trapeze, pretty straightforward. Lunar, you can think of a moon man or just an astronaut for lunar, which is a lunar bone. And a hamate is actually a type of crocodile. So if you could just think of a crocodile, think hamate, associate those two, that's a really easy way to think of the 4 bones. So again, trapezoid, trapeze, lunar, and hamate bones. So those are the 4 carpal bones. Okay, so I like to think of these as waves, and basically what's going to happen to the carpal bones, you're going to push against the flexor tendons, and then the median nerve is going to get very tight as there's waves, compression, pushing up against it. So that's the way I like to look at this. And essentially there are 4 main symptoms that we can list. They're going to be pain, numbness, tingling, and weakness. The first is going to be obviously pain. So in the wrist of the hands, it's not very specific. It's more than general area of the wrist and the hands. There's also going to be numbing. This is a bit more specific. It's going to be numbness or burning sensation. And it's going to be in the thumb, the index finger, the middle finger, and the radial and half of the ring finger, so only the first half. And there's also going to be tingling, which constitutes, again with the numbness, the hallmark symptom of the median nerve entrapment. So this is very important, number 3. And the 4th is going to be a weakness and atrophy of the thumb, which may occur if the condition is not treated. So you definitely want to get that treated. So there are 2 maneuvers that we can highlight the compression, or in other words, find out if a person is dealing with carpal tunnel syndrome. Now, the first is going to be Phalen's test, which is going to be the one up here. So basically, the back of the hands are pressed together, which basically essentially is going to compress the nerve, and this may cause carpal tunnel syndrome. So this is one way to figure it out. The second is going to be Tinel's test, which is basically, both of these are quite simple. It's going to be a test that is going to be tapping on the median at the wrist. So you're going to repeatedly tap the wrist, and if there is a tingling and it consistently worsens with the tapping, then you are most likely dealing with carpal tunnel syndrome. Now, another way I like to visualize carpal tunnel syndrome is with a fish. Now, this is just picture this as a carp fish, which is again a type of fish you can find. It's actually very delicious. So basically, just think of when it comes to a smaller carp, so a smaller carpal tunnel, it is either going to come from being a female, or it is going to be genetically passed down from the parents. So that's how a smaller carpal tunnel is going to be caused. Now, there are also various different things that can cause carpal tunnel syndrome. Now, the first is going to be obesity, hypothyroidism, arthritis, more specifically rheumatoid arthritis, repetitive hand or wrist motion. So if you're a gamer, this could be dangerous. Repetitive hand or wrist motion, again, could cause it. Diabetes, wrist injuries, fluid buildup or nerve damage, and the last one is pregnancy. So yeah, just remember all of these. If you can associate every single one of these images with one, for example, pregnancy, nerve damage, rheumatoid arthritis, obesity, etc. If you can remember every single one of these, you'll be good for the causes. Now, lastly is going to be the treatment. So there's actually a few ways you could treat this. Now, there's several therapies that are proposed to treat the syndrome, but first we have to identify a possible cause that we can evict. So the wrist is going to be maintained in a neutral position by wearing a brace or a splint, and there are going to be some drugs that can help relieve the pain. The first is going to be any NSAIDs. So for example, Tylenol. They help relieve the pain. If that doesn't work, then you want to go into corticoid injections. And if the pain still persists even through that, then you might want to go into surgery. Now, there's some so-called soft therapies that are used, such as acupuncture or re-education. Those are actually very good and effective. But if not, then you want to go into some bigger surgery. So just a recap of the treatment. You want to start by putting the wrist or the hand in a neutral position by wearing a brace or a splint. You're also going to want NSAIDs to help relieve the pain. If that doesn't work, then corticoid injections. If you need to take it a step further, if it is moderate to severe, you're going to want surgical release, which is basically going to allow a release of the tendon, which is going to really help it relax. So yeah, just before we leave, make sure you guys check out Butchered Gardens in the End of the Pacific. It's on Amazon, Kobo, Kindle. It's a really great book. Definitely go check it out. Link will be in the description. And yeah, thank you guys so much for watching this video. Make sure to hit the like button, smash that subscribe button if you're new. Make sure to leave your feedback, comment down below if you have any ideas, suggestions for videos, if there's anything we missed, anything we did wrong, and obviously if there's anything we can improve upon. And if you guys just want to leave a nice little comment, definitely leave it down below. So thank you guys so much for watching, and have a great day.